how have you found the SkiPD's gone so far?
Yeah, I think it's gone really well. I've learned a lot.
Would you come again?
I'd definitely do again, yeah. Yeah, so you can use resin to print like temporary restorations. So that's like acrylic based.
So I'm talking about Enamic, which is like
sorry.
of composite. And,
there's quite
ceramic.
a lot of different brands out there that are like either completely composite or hybrid restorations. There's like Krios.
So what are the hybrid ones? Are they composite and ceramic?
Yeah. So they've got like they've got some like lithium disilicate and some composite. Yeah.
And you use those as permanent?
Yeah. The Enamic's really strong. It just means you can like polish it in the mouth easier. I guess if I've got something that's like a core that's mainly composite, and I think it's not going to be like a permanent restoration, but something that might last a few years, then I'd use like a composite hybrid restoration because it's just because I'm bonding mainly to composite in the core.
Okay. Frank, did you say you use that mostly for your...
Yeah, I used to use a lot of Enamic. Now I use GC Lissig, which is like it's lithium disilicate that's already been put in the furnace, so it's already sintered. So it's not like the Emax blocks that you have to mill in the pre-sintered phase and then put it in the furnace. These are already pre-sintered and then you just hand polish them. So the strength is like almost that of Emax, but you don't have to put it in the furnace.
Yeah, and I just saved you the change time.
Yeah, exactly.
It's nice having the like the option of staining and glazing though to make things like look better for anterior work if you're not going to use a lab. So for anteriors I would still mill in-house.
Because you have better finish with the glaze.
Yeah, use like the different colours to reduce like translucency, malod's, crazing, all the usual.
How long does the design take you? Like if you're doing 3 to 3, how long 4 to 4, like how long would the design take you?
So for that I would usually do it like outside of like clinical time. So I would probably prep and temporise for that, then design. So I've usually would have done a mock-up for it, and use that for the temporaries.
And how long would that take you? Because it's still your time, even if
Yeah. So maybe like, I'll probably say like an hour to 2. Can obviously do it quicker, but sometimes if it's, I'll show it to like a couple of clinicians for like second opinions and get a bit of input on it, so that just takes time.
What tips do you have for me and Jack skiing wise?
Don't stick your bum out as much. I think one of the main ones is always like stick your shins into the front of your boots. Make sure that your legs relax so you're absorbing the undulations of the slope and you can just float over the moguls.
Yeah, that's something I'm not doing.
Because the tendency when you're kind of intermediate skier is that if you slip, you kind of dig your heels in a little bit, and you kind of dig your outside foot into the snow, whereas you want your skis to be working together so that they're both taking like equal weight into the turns.
I do that when I start struggling. I just go sideways, dig in, and sit. I kind of like squat down. So like,
it's usually me on like a red or a black towards the end of the day with moguls.
Yeah, and the other thing is like you want to straighten up when you're coming out of a turn and then bend into the turn so that your legs kind of push onto the snow. So you're going up and down, rather than what a lot of people do when they start off is just stay bent over the whole time when they're going in the same position all the way through the turn, whereas you want to be going kind of up and down to let your legs and hips do the work rather than like bending over with your upper body.
That requires leg strength.
Yeah, the thing is, if you have the right technique, then it's actually much less tiring than it is. Because as a beginner or as an intermediate, you put in so much more work into skiing than when you're a bit more advanced, so you end up just getting really tired really quickly. Yeah. When I was watching you yesterday, Matt, I felt like you were bringing like your heels together. Because you told me that at one point, and it looks like you almost consciously like just took them in together when you turn in. When you slow it down, anyway. Obviously, when you're skiing at like a reasonable pace, you can't really tell you're doing that because it just happens naturally.
How many days a week do you do your fixed ortho thing?
The job?
Yeah.
It's every Friday. But then I do, whoa, that's a scrumpet, isn't it? Still do them at the private practice, privately, but that day is just solely NHS ortho.
What you do with your private practice, do you use like a system now, or is it just you've got brackets, wires, and you can
Just,
do it yourself?
yeah, just got like a big ortho trolley with everything on, just direct bonding. I can use indirect bonding as well, like the CPAS 6 month smile systems, but they're not really that great in all honesty. So they supply like plastic brackets usually.
Yeah.
Whereas the ceramic brackets, if you're going to do like cosmetic gears, the ceramic brackets are much better, more aesthetic.
I've done quick
Still do a lot of metal as well.
I've done quick straight teeth, they give you ceramic ones.
Oh yeah, maybe you can specify it. Yeah. Any monocrystalline or polycrystalline brackets?
No idea.
Because that depends sometimes, like how good they look and how much staining they'll take.
I've done 2 cases, and it's literally a case of taking impressions photos, sending here and following instructions.
Yeah. No, I love ortho. It's definitely like. Do you do quite a bit of Invisalign and other?
No, I've stopped
ortho?
now.
Be more restorative.
Yeah, because I'm not around and I want to like stay flexible and travel.
Yeah, that's true.
I'm not taking on any like Invisalign cases.
Fair enough.
There's a shame of giving so many to like the other dentists that I could have like obviously. But it's alright. I would just still get paid a bit for them. Regardless.
You're still getting like business into practice, which is good for you. And then can you say to those dentists like, look, if they need composite or veneers at the end, I want to see them.
Yeah.
So that could work out in your favour. Yeah. Whitening. Pastries were lovely. I don't know how much of this you want to hear, but because of my bowel situation, I've decided not to go for a Swiss, which I got on the first day. The Swiss was lovely. It was really rich. It had like creme anglaise, chocolate filling, which was really tasty. But I went more sort of plain today, so I went for pain au chocolat, which I really enjoyed.
And fresh orange juice.
The fresh orange juice really helped. I needed some vitamin C. Francois, what brand of whitening do you use and technique for tend to just do
outside?
I use boutique.
Yeah.
And just do normally a few weeks of 10% carbamide overnight, and then if they want to go whiter, moving on to 16% straight away.
Right.
And if they want to go whiter still, then move on to 6% hydrogen peroxide during the day.
Don't know why, but I always start with 6% during the day for 2 3 weeks and get quite a good result that way.
Yeah.
It is a bit weird how there's like no consensus as to like how people whiten and regimes. Like, I think technically 10% over a long period of time is meant to be the best because that's what's been like trialed. But then I don't know if that's actually the best way of doing it. It's just that's the one that's been trialed. Like
Definitely like lower rates of sensitivity.
I was going to say, how do you lower the sensitivity of your teeth?
So doing it over like a longer period, using less strong material.
You want to use it consistently as well, because what a lot of people do is the sensitivity is the worst on day 2 or 3. So a lot of patients think, oh, I'm going to stop because it's really sensitive. And then you're only going to have to get back to day 2 or 3 again, and your teeth never get used to it. Whereas if you do it with some consistency every day, the concentration of gel in your teeth increases over time, but your teeth get used to it. So you end up with much less sensitive teeth and better whitening. You just have to plough through that initial sensitive bit.
You've done tooth whitening, haven't you?
Yeah, I just stopped. I did it before the wedding.
Did I do it?
Yeah. And it was mint. My teeth looked well better, but now they've like gone back.
Yeah, you still got your trays, so.
Yeah.
But they might not fit because you've not worn your retainers.
You've worn your retainers, yeah. They'll fit. You'll squeeze them in.
No, they'll be fine.
Some people, I've heard some dentists say that you'll get less sensitivity by using 6% because you're using it for a shorter period of time, whereas when you use 10% overnight, you get more sensitivity.
I was always worse when I had them in overnight, so I did them for like, which is the one where you did it. It was stronger, but you're meant to do it for like 2 hours.
That's
in
the
an
6% stuff.
evening. That's what I did, and then it's like 2 hours in the evening, and then by the time I'd woke up in the morning, I'd almost slept through the pain. I always found that day after the whitening.
Yeah.
So I'd do it like before bed.
And if you brush with like Sensodyne and stuff before bed, that would help.
Or Toothbrush is quite good.
Yeah.
My lowers get so sensitive.
It's my lower anteriors as well.
I hate topping up my lower teeth.
I do as well, it's horrible.
I've considered just getting like other over-the-counter products for my lowers.
Yeah. Worth knowing. What about tray design for whitening?
I quite like, I keep banging on about scallop versus straight trim line, but I quite like a straight trim line just for the rigidity, to stop gel leaking out, obviously sealed at the gingival margin. Not bothered whether there are wells or not for the gel. I don't
Here's what, do you know I asked you about this, the straight trim line and the scalloped one?
Yeah.
I think the scalloped ones are better sealed.
Why?
Because, okay, comparing them, like, I've used the enlightened scalloped trays, and then I've got, like, my lab's straight ones.
Yeah.
But I feel like the enlightened scalloped ones, because they're, like, cut to the gingival margins of, like, the teeth,
Yeah.
like, sit in and, like, squeeze in better. Whereas the straight ones, there's always a bit of, like,
for me,
like looseness. I don't know if it's just the quality of the individual tray that's being made, but do you know what I mean? How, like, you got a sheet of plastic, you're melting that over, like, the tooth and the gum. It's going to be a bit like, there's going to be a bit of like flow to where it's bending, whereas the scalloped one will be like dug into the margin.
My straight ones, the lab basically score the model digitally at the gingival margin, so they're still putting pressure onto that cervical area, but then you've got the extension onto the gingival margin.
Oh,
because
interesting.
it's flexible, it flexes into the undercuts, but because of the straight.
So they're sort of like scallop with a extension.
Yeah,
fair enough.
And it just gives it more stiffness.
There we go, that makes a lot of sense actually.
Yeah. I quite like the S4S.
So the excess material is there for like rigidity, then you've still got the undercut for the seal.
Yeah.
I feel like from what I know that having the straight margin would definitely give a better seal to saliva contamination, so that would improve whitening results. But then the scallop margins are probably better for the gums, because you're not going to get, if you wipe around it effectively, you're not going to get any of the gel on the gums, whereas if you get a straight higher line, you could potentially trap some gel around the gums and irritate them a bit.
To be honest, most of my patients whiten in their aligners.
Yeah.
And I've only ever whitened myself in aligners.
Well, I found like when patients come for whitening, I'll be like, do you have any retainers? No. I'll be like, well, let's make you some retainers.
Yeah.
And give you a whitening kit because you're going to be paying for white. You're basically paying the same amount for whitening retainers. So make retainers anyway.
Probably just seal as well, but it still works.
They're probably getting more of a long-term benefit from it.
Yeah.
What toothbrush do you use at home?
I've got the latest Oral-B one, the white one. I just, What's the black one? Is that a Sonica?
No, it's a Suri. It's like a new brand.
Alright.
I usually use Philips Sonica.
Do you get a little free trial on that?
Yeah. It's like a new brand which is meant to be like eco-friendly and everything.
Right.
And they give you on half price. It's pretty good. So you see,
What's
it's
that
quite.
cost?
They're 95 quid full price.
So
with
is
like
that
a charging
just for
case and stuff. What's this?
The red one, yeah.
Go down these blues, go to Cornu and do like that area a few times.
Yeah. So go.
Yeah, so I'm using this brush called Suri. It's like a newer brand meant to be like all made with recyclable materials and stuff. It's like a sonic brush, but it's quite like, it's a bit weaker than a Philips, which is what I normally use. But they look really nice, they're quite sleek, they got a charging case which you can charge with like a USB-C cable, so you don't need to take like, they got a 40-day battery life.
Wow. That's the thing with the Oral-B.
Yeah. So it's like, I don't like it as much as my Philips, but for traveling I'll take it because it's just really small
that's good.
and I don't have to take a charger.
So do you say if is it half price for clinicians?
Yeah.
And what makes it eco-friendly?
I think it's just the materials. It's all
Yeah.
like recycled plastics and stuff. Again, maybe just marketing.
Yeah, potentially.
Have you found being here with Oscar at home?
It's not. It's lovely to get away, obviously, and I'd say like last night I really started to miss him. You just because you spend all your time with them usually. Just feel a bit strange being away. But yeah, I feel like I want him to have these experiences when he's older. So if I can suss out a few places and check out ski schools.
Have you been looking at ski schools once you've been here?
Yeah. Hannah was like, find out what age you can start. We getting on, party?
Yeah.
You alright? If you ever want me to leave you a review on anything, as like on any of your
Oh, you should leave. You should leave. We should all leave our clinics like good reviews.
Yeah, actually, that's a really good
Or
shout.
I'll leave you a review on Google.
Yeah.
Because I know what you're like as a dentist.
Yeah, actually, you could do that for me.
Yeah.
A little Google review at some point. Can we talk about blocking out a dark tooth?
Yeah,
Or
let's
prep?
do that.
I sometimes find that quite tricky.
What do you use?
But so, probably a bit limited in terms of like materials. We could order in something more specific, but all of our Emax blocks are high translucency, which isn't great. So I've got a dark prep underneath. I'll probably like prep it a bit more than usual, and add some like base liner to the buccal surface, and then maybe make the restoration thicker.
Yeah.
But ideally, I'd want to like.
What line do you use?
So it's by Venus Pearl. It's called base liner,
fine.
like
Alright,
an
yeah,
opaque material, flowable composite. But I think ideally I would either order some low translucency blocks, or I would send to a lab that they can use a blocking out ingot. So if it's Ivoclar, then you've got the opacas, the stump shades that you can take.
Does that camera say anything?
Yeah.
What does it say?
It's been recording for 10 seconds.
10 seconds?
Yeah.
Or maybe it's just started like a new video.
Yeah.
It's still recording now?
Yeah.
Okay, cool. Sorry, yeah.
Yeah, that does look good.
Yeah, that's similar to what I would do. I think I'd always try to internally whiten first.
Yeah, that's a good shout.
Yeah.
I'm thinking sometimes like keep it like it, if the tooth's healthy periapically, keep in an old post crown in and prepping over the top of that I've done before.
Oh, yeah,
so then you've
fair.
just literally got metal that you can't
Can't
get
block
rid
out,
of. That's
yeah.
difficult.
I usually just take loads of like pictures and stump shade guides and send them to my lab technician.
Yeah, I think that's probably the gold
and
standard.
just kind of ask my lab technician, because it's like you may have one idea of what you're doing, but your technician might.
Yeah.
Like,
I think
feel
that's
the same
one
way.
disadvantage of like in-house milling.
Yeah.
Because the technology's not quite there to do like layering, blocking out with ingots.
Do you mill any Zirconia, Shreve?
We can do, but usually we outsource to get the milling done, because our block size isn't big enough for like bigger bridges, and then we can come back and stain and glaze it in house to our like desires, and then put it in the furnace. But if it's just like a smaller restoration, like single units, we can do that. But usually the setting's like
around about 4 hours. Zirconia, I think.
Wasn't
Is that
he
right?
milling a 7-unit bridge the other day?
Zirconia, yeah. So he'd outsourced that
Right.
to a lab. I think he designed it, sent the STL, they milled it for him because they've got like a bigger milling machine. And then he got that sent back so he could stain and glaze it himself.
Right.
And then usually does that, like as he's leaving work, stick it in the furnace because it's on like a 4-hour cycle.
That's really interesting because he's outsourced like the bit that's like the key benefit of the workflow, hasn't he? He must just love doing it.
Exactly.
Like,
he wants the control over the aesthetics as well.
Yeah.
Because even though like the eyes that some technicians have when they're doing the layered porcelain or ceramics is incredible, he can get some really, really nice results with like in-house stain and glaze because he's been doing it so many years.
Yeah.
I think he's almost pioneered it really in our country because he's been lecturing on it for probably like certainly over 10 years, probably 15 years when it was like quite niche.
Does he do any courses?
Yeah, loads.
Who's this?
My boss, Adam.
All right. You know, if you've got someone who's a difficult patient.
Difficult in what sense?
So
give us a scenario that you can think of.
So they've gone for some sort of treatment. You think that you've delivered on what they've asked for, but they're not quite happy with it.
Yeah. Good question. So I'd first probably ring them up, say, like, hi, is there anything I can do? Gather all their thoughts, concerns, try and get them in for a review, chat to them, and it might just be a case of like miscommunication, having a chat with them and putting their mind at rest. Assess them. If you think it's something that you've not done to the best standard you can, then offer them to redo it free of charge.
Right.
Or if you do think it's as good as it can be, tell them and say there's nothing more that can be done.
And
offer them a second opinion with another dentist in the practice, and they'll probably like agree with you. Or if it's something that you think you could be better but you can't do it, speak to another clinician, refer them, and then you'd have to like fund any like retreatment. But I feel like a lot of it is down to communication.
Yeah, definitely.
So often,
I think
as long as it's been communicated at the start, I've only probably had those scenarios like less than 5 times in my career, not many.
I think that those things happen when you're like younger in your career.
Yeah.
And your fallouts usually either just send it to an older dentist or just refund them the money and fix what's wrong.
I think the problem occurs when you...
And then you learn all like the pre-chat you need to have to set expectations.
Yeah.
But you don't win them all. You do get some patients that...
Yeah, you can't win everyone.
For whatever reason, are unhappy and...
Nice.
There he is, chatting to his boy. Oh, look at this. That started off really nice and then got a bit bouldery.
I'm buzzing after you said that, Matt.
Yeah, it was nice, really nice that. Best of sumo ski.
Oh, very good.
Sorry, Zai, I should have started off with a positive comment. I was just like, Zai, you're not moving your hips.
No, sometimes it's good to be pragmatic.
Yeah, Zai, if you watch that guy skiing down, his body is just facing down like the same way the whole time.
Yeah.
And it's just his hips and his knees that are moving.
I feel like I need to like at home when I'm doing like doing stretching and working out is just to work on that like body dissociation of like twisting.
Just try it now, like exaggerate it.
Yeah.
Yeah, I'm gonna try that as well.
Have your shoulders open.
Want to hear some commentary from you now? Enough. We've done the PD part of the morning. Now it's time for the ski part.
I thought we were doing this one. So I've just been telling Zai that he needs to turn with his hips, keep his upper body facing down the slope. And he's doing it well. He's just probably over-exaggerating a little bit much and sticking his bum out a bit too much. And what I probably want him to do next is use his knees a bit more, bend into the turns, straighten up as he's coming out with the turns. Because you can see he's kind of flicking his heels out to turn rather than using his hips. That's good, that's nice parallel skiing, bending his legs into the turns, still sticking his bum out a little bit, and you can see when he's going a bit faster, he starts digging his outside skiing a little bit rather than skiing with both skis. Here's Jack now skiing really well. Yeah, that was really good. You started off like turning with your upper body a bit.
Yeah.
And then towards the end you were like keeping your torso facing up. Yeah. What will help, because at the minute you're helping you turn by turning your upper body, whereas and now that you're not doing that as much, you're kind of sticking your bum out a bit too much. So to help you turn with your torso facing down, you want to just use the flex in your legs. So bend into a turn, straighten up out of the turn, bend into the next turn, straighten up.
Yeah, I'll try that next. Shoulders down, bend into the turn. Right.
What, should we get that one again?
Was I not bending enough?
Yeah, you probably think you are, but when you look at yourself on film, you'll realise like you really need to exaggerate it to try and like really exaggerate the up and down.
Like maybe if you say, oh, that section you're doing like well, I can look at the point of view camera and see what my vision was like.
Yeah.
Yeah, sometimes when you see like yourself from like a third person's point of view, you're like, oh, do this, it helps.
Yeah.
But also you don't have that perspective when you're
exactly.
doing it. Do you reckon you'll buy a practice at some point?
No.
No. Happy being an associate?
Yeah. I love the dentistry and going to work each day and doing the practical work, but I just could not be bothered with all the admin associated with owning a practice. And to be honest, I just don't think I'm a business person.
Yeah. Yeah, as in, obviously I don't own my practice, but I do a lot of the running of it, or helping with a lot of the running of it.
I think you're quite business minded.
Yeah,
and
I love it. I really enjoy those challenges. But you do realise like 95% of it is nothing to do with clinical dentistry, because the main challenges I've had over the last year and a half is hiring staff, interviewing staff, training staff.
Yeah, exactly.
Like,
it's all staff problems.
It's all staff stuff, yeah. Staff, and then also getting really granular into the financials of everything. How much material and chair time and marketing and rent, and then you really, I literally I hear myself being like the principal that was a bit annoying when you were a young dentist. And you're like, when, for example, there's an emergency, right? Patient's like, oh, I've got a broken tooth, I got pain, and the dentist is like, no, I don't have enough time in the diary. and you're like, these are the most lucrative patients to the practice because they have a specific problem.
Yeah.
They probably need endos and crowns. They're going to pay to go ahead with it because they're in pain. We need to see them.
Yeah.
We need to squeeze them in, get them here. The associate's like, nah, I need an hour to do my extirpation. You're like, no, we need to get this person in the clinic.
Yeah.
Squeeze them in, double buck them and stuff. It's like, it's really annoying because I am also like, I know I still want the associates to have like, a good time and stuff. But when
have
you're
some
like,
freedom.
When you're like, oh no, this month we're behind and we're not going to make money and it's going to be tough and all that, you're like, no, we need these people in the clinic.
Yeah, I think as an associate as well, you don't really realise how much everything costs.
Yeah.
What have been the most major surprises that you've had going from, or things that you've learned going from being an associate to not owning your own practice, but that side of managing a practice, basically?
I think it's staff. I underestimated how hard it is to get a private practice busy. I kind of assume, I think there's loads of factors, like our clinic's not on like a busy high street, so we don't get footfall. So it's really, really difficult to get people in. And hiring staff, managing staff. For example, like we'll get a receptionist, we really like them, spend 4 months like training them and everything, and then they just disappear. Like it literally happens where they just don't turn up to work.
Wow.
And you're like, and then you have to then go in and cover, and you have to run reception and answer phone calls, get a job ad out, start like interviewing more people, and then you're like, oh, this person's not the best, but we need someone, and then you go through this like cycle, and it's like all of that can be avoided with like good planning, but all of those things are like really difficult.
Yeah, I can imagine.
And that's what I mean. I actually really enjoy it. Like I love those like challenges.
Yeah.
Trying to be creative, but
I would not enjoy that.
Yeah, exactly.
of the day. Think we found the contender. Should we do that blue that we said we were going to do?
I don't know whose fault that was.
A tangle video.
Yeah.
It's like the one yesterday. You got your
We'll have to check. We'll have to check the video footage to see. Yeah, bending a lot more. Right?
Yeah, that looks loads better. You can see as it went a bit faster.
Yeah, it's like getting a bit bummed out.
You started like hunching over a bit, but the first bit was really good.
It's that like safety mechanism where you're like just resisting, aren't you?
Yeah. So when it starts getting a bit faster, rather than bending over, just like dig your shins into your boots and bend even more.
Basically get more, because I found when I was bending I had more grip.
Yeah.
I wasn't going as quick, or I felt more, maybe I felt I wasn't going as quick because I was more control.
Yeah.
So the faster you get, again, counterintuitive, get more into it, you have more control.
So you don't want to, when you bend your legs, you don't want them to be like stiff bent. You want them to be really flexible so you just absorb the slope. Yeah. Sharif snowplows off the. Off the
he does like a little jiggle. What's the time?
25 past. Is that it now? Yeah. No more runs?
25 past 10?
Yeah. Oh, can we do one more?
Is there one more run to do?
Probably don't have time, because by the time we get, this will take 10 minutes to get down. Yeah, cool.
was the scrumper move, wasn't it? Oh, boys. I always think like it's a success as well at the end of the last skiing, when everyone who's come on the trip has made it and there's no injuries.
No injuries.
How is it to think